Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Please subscribe to our Scripps Health YouTube channel. We've got great information for you, featuring the latest technology, our stellar doctors, and inspiring patient stories. Americans struggling with their weight has reached epidemic proportions across the country. According to the Centers for Disease Control, more than 93 million American adults are very overweight, and it's putting their bodies at risk. Have you tried to lose weight? Has it been a struggle? Please let us know what you've tried, what's worked and what hasn't. Just write it down in the comments section below. How do you get rid of that excess weight? Because if you don't, it can really shorten your life. Joining us, Dr. Ken Fujioka. He's an endocrinologist who is the director of the Nutrition and Metabolic Center at Scripps Clinic in Del Mar, California, and Dr. William Fuller, a surgeon at the clinic in Del Mar who specializes in bariatric surgery. Thank you both so much for being here. Dr. Fujioka, talk about the epidemic of people being very overweight. Why is it on the rise? What's the cause?
It's one of those perfect storms. We have a combination of less activity. Our food has changed dramatically. It's much more processed, and it's real clear, beautiful studies showing that if you just eat less processed food, you can lose weight. But again, the food has changed. And then we're hardwired to keep any weight that we gain. So in other words, as humans gain weight, a part of their brain called the hypothalamus that you can't control, this is basic brainstem biologic function, is going to try and keep that weight at the highest weight that anyone has ever reached in their life, and it'll stay that way forever.
That's interesting.
This is all brand new stuff.
Yeah,
we had no idea. We thought, well, you just lose some weight and you keep it off, but it turns out, no. And actually, this was all figured out from the show, The Biggest Loser. When they followed those people afterwards, they would lose weight. They'd lose 100, 150, 200 pounds, some of them. But then all of a sudden they found when they checked them afterwards, 5, 6 years later, two things had happened. One, they lowered their metabolism inappropriately, way too low, such that the body was trying to gain back weight, and it never readjusted. It always stayed low, even though they were doing everything right, exercising, eating right. The other thing, though, is the hormones that also control food intake, hunger, satiety, and metabolism all turned in the wrong direction to try and bring their weight back to what it was before.
And what about being severely overweight in kids? Because kids obviously are more active than adults, so why is it a problem in kids? Is it because of the food?
Yeah, so the food has changed for kids a lot, so they have much more access to food. And it turns out that activity level, particularly for young women, so we're talking once girls hit middle school, their activity level drops dramatically and you start to see the weight going up. Boys are a little bit later, but not far. When they hit high school, their activity level goes down because, again, we have all these competitive sports and there's just not enough places for all these kids to exercise.
How do you know if you are severely overweight?
So we have various definitions. We use a thing called body mass index. But
BMI.
Yeah, exactly, BMI. But the short of it is that once somebody's about 30 to 40 pounds overweight, they're heavy enough that we know their lifespan's going to be shortened. And if they're 50 or 60 or 70 pounds overweight, their lifespan's going to be dramatically shortened.
And Dr. Fuller, if you don't get a handle on your weight, what can it lead to?
Not getting a handle on your weight can lead to serious medical consequences. Heart disease, which can lead to heart attacks, diabetes, and there's several consequences of having diabetes that can impact a patient's life really negatively. Kidney disease that could result from that. You can develop vision problems. There's a number of issues that go along with diabetes, which obese patients really struggle with.
Stroke as well?
Stroke can happen, and it's definitely a higher risk factor for patients who are struggling with obesity.
And what about cancer?
So yeah, that's the two things we're worried about. Cancer, we've gotten a lot of cancers under control except for the ones related to weight. So breast cancer, uterine cancer, colon cancer, all these things are actually rising, not just level, they're going up. And then, as Dr. Fuller mentioned, cardiovascular disease, stroke is the one we can't seem to get better because it goes up as you get heavier.
And it's expensive to be overweight, isn't it? I mean, the medical cost of treating people who were severely overweight is more than, what was it, $147 billion?
Yeah, this is a tough one because once somebody gets to a point of being seriously overweight, the cost can double or triple what it'd be for somebody who's that same weight and has the same medical problems. But the biggest thing, and Dr. Fuller mentioned this earlier, is diabetes. Once diabetes comes in and it's clearly weight related, now you're looking at a cost that could be 10 times someone else.
There was a statistic which said that people who are really overweight spend more than $1,400 more a year on medical costs than folks who are not overweight.
And that's just out of their own pocket. That's not the healthcare spending more, all the other things to go with it.
Now, do weight issues affect one group more than others?
It does. It affects it in different ways, though. So if we look at the minority groups, Hispanic, African American, Asians, they are actually very much affected, even more so, say, than Caucasians. We're not sure if it's just the social economic. Is it cheaper just to get fast food? Maybe not. It could be other factors that, particularly for the Hispanic population, we're seeing young Hispanic women get heavy very quickly at relatively young ages. African American women, same. The guys, though, are right behind, and they're moving up quickly. And if you go outside of the U.S., say to Mexico, which is very close to us in San Diego, they're actually surpassing us in the percentage of people that are overweight.
As you get older, why is it harder for you to lose weight, Dr. Fuller?
You've got several aspects of your life that are really impacting your ability to exercise. Your metabolism is slowing down in many regards, and your ability to get out and do exercise and be as active is diminished due to time demands, career demands, family demands.
Is there a genetic component to it? If your parents were overweight, is it more likely that you'll be overweight as well?
If just one parent is overweight, or the two parents, half those kids are going to struggle with weight. But if both parents are overweight, 90% of those kids are going to struggle with weight. So it's really tough when you have parents that are overweight. And even if you take a child who comes from two parents that are overweight, but you adopt them into a thin family, they're still going to struggle with weight.
So it's genetic. It's just not a question of inactivity.
That's right. It's
or
not.
Eating habits.
Yeah. It's more than that. And again, it's the biology that you're fighting. You mentioned, though, older Americans struggling with weight, and it's particularly rough on women once they hit menopause. Once they hit menopause, you see this huge drop in ability to burn calories. So that patient is doing everything the same. They're eating the same. Their activity level actually isn't that much lower, but all of a sudden they hit menopause, they're not burning as many calories, and you see the weight creeping up. The good news is that we find that older patients, say above 60, actually do well with weight loss because they have the time and they understand what it takes to get their weight down. They're willing to do what it takes.
Okay, we want you to hold this thought. We're going to come back to this in just a couple of minutes. What contributes to binge eating, and how do you treat that? We'll come back and talk about this a little bit later on. How do you begin to lose weight if you have struggled with it all your life?
So the standard of weight loss is still diet and exercise, but we've actually gotten a lot better at the diet part. We understand it better, and the exercise. In the past, we said, you got to eat breakfast. Guess what? You're wrong. You don't have to eat breakfast, and you can still lose weight and do fine. Little things like, it turns out, if you just weigh yourself every day, you will do better. You will lose more weight. And then the exercise component, it's real clear now that it isn't just cardio. It's just not the number of calories you burn, but rather it's this combination of doing some resistance training and some cardio.
Are there different diets that work? I mean, I know that this keto diet, is big right now.
Yeah, keto diet is huge right now, intermittent fasting, and it turns out they do work. They have to be done appropriately. Keto diet is a little bit on the fence because it does raise triglycerides and you're adding in fat, which is probably not a good idea. But things like intermittent fasting, where you are getting into ketosis, but you're not adding additional fat, you can do well.
Explain to the audience what ketosis is.
Okay, so when you remove carbohydrates from the diet, the body then is literally forced to run off just fat, which is good. But when it runs off fat, it begins to release a byproduct called ketones. And ketones, it's interesting because you may feel a little bit different on them. You can function fine, but in ketosis, it's clear you're just burning fat, and you probably save your muscle mass. In other words, you don't burn any of your muscles, you're just burning fat.
So, in addition to diet and exercise, if you're severely overweight, there's obviously surgery. Dr. Fuller, why don't you talk about the different types of bariatric surgery and explain, let's do the basics. What is bariatric surgery?
Bariatric surgery is a cumulative name for weight loss surgery. Weight loss surgery is essentially, at this stage, more or less two surgeries that we perform at Scripps. Gastric bypass surgery or the sleeve gastrectomy. And these are surgeries designed to help patients control appetite, deal with portion sizes, and really kind of learn a different, better way to consume food.
So what is gastric bypass surgery?
Gastric bypass surgery is a procedure in which a surgeon will alter the size of the stomach, reducing it from a size of roughly this big down to about that big. And along with this reduction in the size of the stomach, an intestinal bypass is performed as well.
So you're actually reducing the size of the stomach?
Correct. Significantly, actually.
And what is gastric sleeve surgery?
Again, this is a procedure in which a surgeon will also reduce the size of the stomach. But in this case, we are narrowing the stomach to make it a tight conduit, thereby, again, slowing down the passage of food through the stomach and helping patients to control their portion sizes.
And is this minimally invasive? Does this come with robotic surgery, or is this like a huge, great big deal surgery?
So when we talk about minimally invasive surgery, this is surgery which in the past was performed with larger incisions on the abdomen. Now we do or use little small incisions to perform the same task that we once did with larger incisions. This diminishes the impact of the surgery on the patient and facilitates their recovery.
But it's really tiny incisions, right? So you're not cutting the whole stomach open.
That's correct. The abdomen is does not have the large incision that we had to do in years ago, and less traumatic for the patient.
So with this, the gastric bypass surgery that you're doing now, how fast is the recovery time, and how fast do you see results?
Patients are typically relatively pain-free 2 to 3 weeks following the surgery, and weight loss results begin immediately, essentially, and some effects, especially with gastric bypass surgery, when we talk about the metabolic effects, again, occur relatively instantaneously once the patient starts to have the procedure done, once the bypass is done.
And what's the success rate of these surgeries?
We define success in many ways after these procedures. Most patients define success in their quality of life and in improvements in just daily activities, other quality of life issues such as just being able to get on a plane and not have to take 2 seats, being more active with their children. So there's a number of measures that patients use to define their success. We as surgeons and physicians define the success based on how much weight patients have lost and reduction in their medical problems. Patients enjoy a large amount of success following the surgery, especially when we look at the weight loss, which for most patients is between 60 and 80% of their excess body weight.
So how do you prepare for this type of surgery? I mean, is there certain criteria that that you must meet before you're considered a candidate?
So to put it in perspective, if you do diet and exercise, you got a 20% chance of getting meaningful weight loss. 20%, 1 out of 5. But if you do, say, diet, exercise, and meds, okay, 50-50, maybe 60% of meaningful weight loss. You do bariatric surgery, you're talking 80-85% chance of getting very significant, meaningful weight loss. And when we say that, it's because of, as Will said, all the changes in the hormones that happen. Sure, you can't eat as much with bariatric surgery, but what happens is the hormones change and they move in the right direction to keep your weight down.
But bariatric surgery is not for somebody, for example, who wants to lose those final 10 pounds. Bariatric surgery is for somebody who is how overweight?
So generally speaking, a patient who is roughly 100 pounds over the clinical ideal weight is a candidate for surgery. And this is a rough measure for someone who would be a good candidate.
What are the risks to these surgeries?
Like any surgery, there are inherent or innate risks with a procedure. And speaking generally, there are risks of gastrointestinal leak. There's a risk of, which can lead to infection. There's risk of having a pulmonary embolus, which is a blood clot in the lung arteries. These are some of the more prominent risks. Thankfully, these are very low risks and generally speaking, lower than 1%.
And what about the side effects to this surgery?
Thankfully, the side effects aren't that plentiful. But for gastric bypass patients, there's any number of gastrointestinal type of symptoms they may exhibit. They may have nausea or constipation, certainly indigestion to certain types of foods. And these are more the notable side effects. And similarly so with the sleeve gastrectomy.
There are certain side effects that can be long-term. So once somebody gets bariatric surgery, they really need to at least be seen yearly by somebody who understands what's going on. I'll give you an example. Vitamin deficiencies are by far the most common. Vitamin D is number one. We see that the most. But you can also get certain B vitamins, which can be very serious. You can get changes in your meds that you need. And particularly for diabetics, usually we have to rapidly remove their diabetic medications because they get too low in their blood sugars. And so the side effect would be hypoglycemia. But to make a long story short, all these vitamin and nutritional problems are very well characterized. We know how to fix them, and as long as you're checked regularly, you do well. But you got to take your vitamins.
So how do you prepare for this type of surgery? Is there certain criteria that you have to meet?
Yes, you need to be psychologically ready, and so everyone has a psychological evaluation to ascertain one's readiness to undergo this massive lifestyle change. You need to be medically fit to undergo the surgery, and so thus your physician needs to okay you to have the procedure. You need to meet with a dietitian so that you can understand the proper ways of eating, especially following a bariatric surgical procedure.
So let's come back to this. We referenced this a few minutes ago. What contributes to binge eating? Because I know that there's a mental component to that as well, isn't it?
So that's one of the disease states that's really changing. So we used to think binge eating was this psychological problem that probably resulted from when you were a kid and you were put in the closet because you didn't do your homework and you didn't finish your Brussels sprouts. Well, it turns out that's probably not correct. It turns out there's a part of the brain that signals fullness or satiety. It's a receptor that in about 1 in 20 people that Dr. Fuller sees is broken. So what happens is the messages come up to tell them to stop eating, but the receptor's broken. So these folks unfortunately don't know when to stop eating, and it's genetic. They just inherit it. Nothing they did, not related to any psychological event, but they're sitting there and they're eating a plate of food and they're still not full because the receptor's broken to that. So they start looking around. Have they finished? Oh no, they have. Oh, they finished. Maybe I better stop eating. But some of them, they have no outside cues, so they'll eat 2 or 3 portions. So they're binging. And they know to stop because it feels so uncomfortable. So we need to know about that for 2 reasons. One is we know that when they do the bariatric surgery, they won't do quite as well. That's okay because we have certain meds that will help that receptor to work better. So times are really changing in that, yeah, sure, there are some people who binge, it's psychological, we call it hedonistic or reward eating. But that's actually a small minority. Many of them, they were just born with this part of the brain that just doesn't figure out when it's full, so they binge.
But the eating disorders that you have to consider before you have the surgery is, is somebody eating because they're stressed, and so food is an emotional relief for them, or if somebody has, What are some of the other eating disorders that you would have to address before you had this type of surgery?
Well, bulimia is a big one. So if somebody's purging, that's a big red flag, because that can create a lot of problems afterwards. The other really common one is cravings, or again, what we are trying to figure out what to call it, but it's just somebody, and they won't binge, they won't eat a large amount, but what they'll typically do is crave a food that's very tasty, something like, for most women, it's chocolate. For guys, it's actually savory things like fries, burgers, pizzas, things like that. And so they'll come into a situation, as you mentioned, stress is a common producer of this kind of behavior, where you're then going to want to eat that piece of chocolate, or you're going to want to have that burger, because it kind of takes you out of that realm for just a split second, and you feel good about it. So we need to counsel patients. They need to be aware of that so that they can not reproduce that behavior.
So when should you consider weight loss surgery as an option?
This is a decision that patients and their physician should make in concert. But generally speaking, patients who have really been struggling to lose weight, who are roughly 100 pounds over their clinical ideal body weight, and really feel like they've kind of reached the end of the rope with other weight loss regimens.
Yeah, if you look at all the guidelines from the different societies, they're all going to tell you this. One is you need to be heavy enough. Okay, that we have a lot of patients like that. I mean, it's hard to imagine that roughly 1 to 2 Americans out of just 10, so we're talking 10% of the population running around, meets the criteria for bariatric surgery. And again, we're just in a society where it's tough to lose weight. So as long as they've tried, medical therapy and failed, they need to actually start thinking about bariatric surgery. And I can tell you, almost all the women we see, they've done Weight Watchers, they've done Jenny Craig, they've done a lot. They're good to go. They've made a real try. Some of the guys, most of them actually have tried, but some have not, and so they need at least a trial. And then the other group that we're not mentioning that Will sees a lot of is this group where they're really large. We're talking over 300 pounds. We get their weight down with medical therapy, but again, we don't do as well as surgical. So we might get them down 20, 30, 40 pounds, but they're still, say, 250 or 280, and they need to lose more. Now you start to think about surgery. Once patients begin to lose mobility, we get scared, because we know their lifespan's really going to shorten up quick. So I will personally, as a physician, say, hey, look, we need to start considering bariatric surgery, because you're now not mobile, and we know that really impinges not just on quality, but really big time on health.
Is there anyone who is not a candidate for this kind of weight loss surgery?
Again, one of the primary criteria is that a patient needs to be medically fit to undergo a surgery. And by that I mean if they have medical problems like heart problems or lung problems that would prohibit them from having a surgery, such as severe congestive heart failure or restrictive lung disease, and where their doctor won't clear them. That's one criteria that, or one class of patients that would not be candidates for surgery. There are certain gastrointestinal disorders that may exclude a patient from having a surgery, certain forms of inflammatory bowel disease, or certainly if a patient has cancer of their intestinal tract, or if they've had previous significant small bowel surgery, that could exclude them from having gastric bypass surgery.
Yeah, so there's 2 that we look for on the front end as we're doing the medical therapy and seeing if they're good candidates for bariatric surgery. But one of the bigger ones is, can they comply? Can they follow up? Because if they can't follow up, they're going to have problems, because again, they have to take certain vitamins. They can get osteoporosis if they don't take their calcium or their vitamin D, things like that, and they can get some very serious problems in the beginning if they're not taking their multivitamins. So, and then they need to be followed. What if they have a problem? Okay, they need to see the surgeon, or they need to see me for a medical issue. The other one that's a little bit tougher to distinguish is somebody going to have problems where they can't have food around? I'll give you an example. We had one patient who just really, food was everything to this person, to a point to where now you do the surgery, they can't eat these large portions of inappropriate foods like they want to, and they went what we call psychotic. In other words, they really were just so depressed and so unhappy, and went off in a very unhappy world because they couldn't use food like they used to. And these are patients that's why we have these patients see a psychologist before. Sometimes I'll pick it up, but I can miss it because I'm not trained in psychology. But that's why they see a psychologist, to make sure that they understand what they're getting into and that their relationship with food is going to change.
So they have to be psychologically ready.
Yeah.
Any final thoughts, gentlemen?
You know, I hope if anything we get across is that, one is, this is a real different era. We've learned a lot about how humans regulate weight. Why is it so hard to lose weight? And it turns out it's because the body biologically fights it. It's not, believe me, the patients are trying really, really hard. And again, that wild study from The Biggest Loser showed that these folks were trying so hard, spending 8 to 10 hours a day trying to keep their weight down, and even half that group started to regain and were struggling. As a matter of fact, I think it was 75%. In other words, most of the patients were regaining at a quick rate. And it's not, again, because they're not trying, it's because the biology's changed. Their metabolism dropped, and the hormones that control food intake are all off in the wrong direction.
I think what we do here is we help patients to give them hope, to allow them to recapture aspects of their lives that they aren't living anymore, and the chance to live a longer life. And I think that's the ultimate goal of doing bariatric surgery.
Thank you both so much for being here. We really appreciate it.
Pleasure.
If you'd like more information on how to deal with being overweight, including the possibility of bariatric surgery, please click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.